Debate, the Honourable Member for Vancouver Kingsway.
Thank you, Mr. Speaker. Canadians need a national strategy on Lyme disease to ensure that testing and treatment options in Canada are improved. The New Democratic Party of Canada supports Bill C-442 and congratulates the member from Gulf Islands, Saanich Gulf Islands, on her initiative. We believe that this bill lays out a concise plan for educating Canadians about disease risks and, most importantly, provides a better quality of life for Lyme disease sufferers. Lyme disease is caused by contact with the bacterium spread by tick bites, and ticks are, of course, small parasites that feed on the blood of animals and humans, and they pass on Lyme disease when they feed on mice, squirrels, birds, or other animals who carry the bacterium and then bite humans. Ticks are more common during the warmer months from spring through to late autumn, and Canadians who live in areas with mild winter temperatures and minimal snowfall have an increased risk of coming into contact with ticks. Climate change is one of the factors causing more and more regions to be at risk, with warmer weather increasing tick distribution across many parts of Canada. But Bill C-442 is especially important to British Columbia and coastal communities, as Lyme disease is currently more of a concern on Canada's west coast due to its mild temperatures. Lyme disease symptoms can include a circular rash around the bite, fatigue, fever, headache, weakness, abnormal heartbeat, muscle and joint pain, and central and peripheral nervous system disorders. Symptoms get progressively worse if the disease is left untreated, which it is for many Canadians. Chronic Lyme can develop if the disease is left untreated and can have lasting effects for months or years afterward, and according to Health Canada, can have recurring arthritis and neurological problems. Mr. Speaker, in 2008, NDP MP Judy Wasilija-Lease urged the Health Minister to implement a national strategy to diagnose, treat, and create better surveillance of Lyme disease. I'm very proud of the member for Vancouver East, our official opposition health critic, who has continued the call for national Lyme disease strategy since that time and seconded Bill C-442 when it was introduced by the member for Saanich Gulf Islands. Now, this strategy is long overdue. Canadians deserve to get adequate testing and treatment for this disease. The federal government is responsible for improving the surveillance of Lyme disease as well as establishing best practices so that the provinces can understand the disease and adopt evidence-based measures that improve outcomes. Mr. Speaker, the bottom line for this, of course, is that receiving early and appropriate treatment would improve the quality of life for thousands of Canadians and their families. Early treatment of Lyme disease reduces the severity and duration of illness. More accurate testing and earlier treatment of Lyme disease would reduce the healthcare costs associated with a lengthy illness and more severe side effects, particularly for women who suffer long-lasting side effects when their Lyme disease goes untreated. The New Democrats have been working with Canadians in support of a national strategy on Lyme disease for years now. We believe that now is the time for the federal government to adopt such a strategy to protect the health and safety of Canadians in the face of this rapidly spreading disease. Thank you very much, Mr. Speaker, and I urge all members to support this bill.